Hey everyone, welcome. I am so incredibly thrilled to have you here for this explainer. Today, we're talking about something that is, well, it's just incredibly close to our hearts here at Next Level Speech and Physiotherapy Center. If you don't know us, we're Dubai's premier rehab clinic over in JBR. We're going to dive really deep into our specialized developmental approach to guiding a child's communication journey with Down syndrome. And hey, if you're a parent or a caregiver tuning in right now, take a breath. You are in exactly the right place.
You know, there's this specific mindset we really love to emphasize from literally day one. It's this: you are not in shock, you're in planning mode, and you are doing exactly the right thing. It's funny, actually, how perfectly that captures the kind of unique energy parents bring right into our clinic. When you get a diagnosis, your brain immediately goes, okay, how do we figure out the absolute best path forward? I just want to validate that proactive mindset for you right now. Seeking early, expert guidance is absolutely, hands down, the best first step you can take. We are totally here to honor that energy.
So, what's our mission? It's pretty straightforward: empowering communication from early infancy all the way through adolescence. Here at our JBR Center, our team has had the absolute privilege, and I mean that, it's a privilege, of supporting over 7,000 children and their families through every single developmental stage over the last 11 years. In our clinical experience, speech and language therapy, it isn't just an option. It is literally one of the most impactful interventions available to unlock your child's true potential.
All right, moving into Section 1, Understanding the Communication Profile.
Before we can build a really successful roadmap for your child, we have to understand the lay of the land, right? We need to know how Down syndrome specifically affects communication. When we look at receptive language, which is just a fancy way of saying what a child actually understands, compared to expressive language, what they can actually say, what we consistently observe in our clinic is that receptive language is much, much stronger. So there's often this, well, we call it a frustration gap. Your child understands way more than they can verbally express to you. And honestly, bridging that exact gap and giving them the tools to share their amazing inner world, that's the whole focus of our therapy.
And you know, this expressive gap doesn't come from nowhere. It's grounded in real physical and medical factors. Kids with Down syndrome often have low muscle tone in their lips, their tongue, and their jaw. Imagine trying to speak clearly when your muscles just feel completely exhausted. That makes the physical act of precise articulation so much harder. Add to that the higher rates of middle ear infections, which can cause this fluctuating hearing loss, plus some internal challenges with grammar and sentence structure. It's a lot to juggle. But understanding these physical factors helps us set really realistic and productive expectations for our therapy.
Okay, that brings us right into Section 2, the developmental journey.
This is basically our roadmap, a clear chronological guide for your family. Notice how our clinical focus naturally shifts as your child grows. In infancy, actually, we aren't even really focusing on spoken words yet. We're looking at things like feeding, oral motor development, and simple signing. Then, as we move into the preschool years, the focus naturally shifts to early vocabulary and play-based coaching, with you, the parents. By the school years, we're building up those literacy foundations and social classroom communication. And finally, in adolescence, it's all about functional independence and navigating those really tricky, complex social situations. We're walking with you through every single phase.
Next up is Section 3, Signs You Need Urgent Support.
This is crucial, guys, because sometimes waiting is just the wrong move. There are a few critical indicators we always look out for. If you notice things like very limited communication attempts beyond your immediate family by age 2, or maybe severe behavioral frustration that's clearly linked to communication, or if their speech is unintelligible even to you, their close family members, or if you see a plateau in their progress lasting several months. Oh, and unresolved feeding difficulties or hearing concerns too. If you see any of this, please don't wait for your next scheduled review. Contact our clinic at Next Level immediately. We'll absolutely prioritize an assessment for your child, because honestly, catching these hurdles early just changes everything.
Let's jump into Section 4, our clinical therapy approach. I really want to demystify how our team actually handles assessment and treatment. Step 1, we adapt to the child's unique profile. Because, let's be real, standard population norms simply do not apply here. We tweak all our cognitive assessments to fit your child's exact capabilities. Step 2 is deep collaboration. At Next Level, we heavily involve you in coaching strategies, and we work hand in hand with occupational therapists and schools so everything fits into one coherent picture. And Step 3, this is the fun part. We design highly motivating interest-based therapy sessions. Look, if your child is obsessed with trains, dinosaurs, or a specific cartoon, you better believe we are building our speech targets right around those interests to keep them fully engaged.
That kind of tailored approach naturally brings up a question I get asked literally all the time by parents. Should we push for more speech instead of using signs?
It's such a wonderful question, and it's the perfect opportunity to talk about our philosophy on augmentative and alternative communication.
Here is the honest truth. Speech and signing work together. They are not in competition. What we consistently find in our practice is that pressuring a child to speak before they are physically ready, well, it can actually skyrocket their frustration and make them want to communicate less. We definitely don't want that. Using signs gives them a reliable voice right now. It drastically cuts down on that frustration and, clinically speaking, it actually supports and encourages spoken language to emerge naturally. It's a total win-win.
When we track progress over time, we see some really distinct patterns. Vocabulary? That often grows steadily and much, much faster. Speech clarity, on the other hand, is a bit slower. And that makes sense, right? It requires precise physical motor learning. We're basically retraining those oral muscles we talked about earlier. We always want to set honest, compassionate expectations with you. Clarity takes time and it takes patience. But I promise you, at our center, we make it a point to celebrate every single milestone, no matter how small.
All right, bringing us to our final section, the power of early intervention.
If there is one absolute most important takeaway from our 11+ years of hands-on experience, it's this. Start as early as possible, ideally within the first few months of life. I urge you, please, please do not wait for speech delays to become obvious. Those early months are exactly when we lay the vital groundwork for lifelong communication. By working on feeding and oral motor skills from infancy, we are actively setting up the physical foundations long before that beautiful first word is ever even spoken.
So, that brings us to a thought-provoking question I want to leave you with today. What foundational steps are you taking today to unlock your child's communication tomorrow? Guiding your child's development is such an incredibly rewarding journey, and you absolutely do not have to navigate it alone. We'd love to invite you to reach out to our expert team right here at Next Level Speech and Physiotherapy Center in JBR. Let's start this life-changing journey together. Thank you so much for hanging out with me for this explainer, and I really look forward to seeing you and your incredible kids very, very soon.